Okay. Interview with Dr. Petey. I promise you he's a real trauma surgeon. What's the worst patient you've ever had?
The worst what do you mean by worst patient I've ever had? The worst behaved?
Yeah.
Um, so um, I had a lady who threw a bedpan at me once. Do you know what a bedpan is?
No.
A bedpan's a little piece of plastic that you can, when you're laying in bed, you can poop or pee in,
Was it full
so you
of
don't have to
crap?
get. It was not. It
Was
was
it
just an empty bed, but she threw it at me because she was mad at me.
what'd you do?
I I don't really remember. I was a
Um,
little sarcastic, I think, but she was misbehaving beforehand.
oh. Which specialty do you hate to does that say consult the most?
Which specialty do I hate to consult the most? I'd have to say psychiatry.
What's that?
Psychiatry are the doctors who
Oh, is that like the
kind
brain
of
people?
deal with mental health issues and stuff like that.
So you don't like that?
I don't like consulting them in the hospital because oftentimes we don't get um, there's not a lot that they can do from inside the hospital.
So what does consult mean?
Consult means ask a different specialty their opinion on something. So if I had a patient who came in with a broken clavicle, I
Me.
would consult orthopedic surgeons to have them tell me exactly what needed to be done.
What's the longest surgery you've ever done?
Probably let's see, as a resident, I did several 12 to 14-hour surgeries.
What were they on?
Um, most of those were actual they're called Whipple procedures. So a Whipple procedure is where you take out the head of the pancreas. That's usually done for people with pancreatic cancer.
For me?
And some no.
Yeah, but my
Yeah,
pancreas doesn't work. That's why I have this.
that's correct. Your pancreas doesn't work,
So
but you
did
do not have
pancreatic
pancreatic
cancer
cancer.
win? Did it?
What?
I don't know. What's the most common trauma injury with you see with children?
Um, Luckily, we don't see a lot of injuries with kids. Head injuries are fairly common. So, kids who are not wearing their helmets when they're either skateboarding or riding bicycles and they fall off of them and hit their heads. I'd say that's probably the most common thing that we see. So, when you're doing stuff like that, when you're riding your bike and riding skateboards or rollerblading or anything like that, you always need to wear your helmet.
Ouch.
You have
Oh,
stop it. You have a broken clavicle.
I slipped. Okay. How many energy drinks do you need to get through a shift?
Zero,
0.
zero.
Not even
I
one.
stopped. I
Not
stopped drinking energy drinks over a year ago.
not even one little monster.
Not even one little monster.
What
I
about
don't drink
Lay's salt
coffee.
and vinegar chips?
Salt and vinegar. What is wrong with you? No, I stopped drinking coffee and I stopped drinking excessive amounts of caffeine.
What's this do?
That's the M57 Clacker. It's a firing device for a Claymore mine.
Ooh, can I use it?
You can't do anything with it, but it's a good little
Oh, I see.
stress relief.
It needs plugged into an outlet right here for it to work.
So that's where you plug the blasting cap into, and the blasting cap goes into the Claymore mine.
Hold up. All right. All right. Ouch, that burns. Don't stick a knife into a light socket or an outlet or whatever. Okay. Do I have any more? How many gangsters have you had?
Lots.
Who was your favorite one? Was it my buddy?
I don't remember any of their names. I don't remember details about them, but working in inner city Cleveland, it was not uncommon to have gang members come in